Respected Principal, Institute of Pharmaceutical Education and Research, Wardha, Dr. R.O. Ganjiwale, sir, our esteemed guest and my dear friend, Dr. Zeenat Iqbal, Professor, School of Pharmaceutical Education and Research, Jamia Hamdard, learned teachers, my fraternal comrades, and dear students, a very good morning. With great honor and privilege, I, Dr. Shagufta Khan, welcome you all to the 2 days National Conference on Nanotechnology in Healthcare is sponsored by the APTI Maharashtra State and organized by the Department of Pharmaceutics and IQAC. We are honored to have all of you join us today as we embark on this incredible journey of knowledge and innovation. At the outset, I would like to acknowledge the APTI Maharashtra State for providing us this platform to discuss the breakthrough in nanotechnology research. I would also like to acknowledge our distinguished speakers who have kindly agreed to share their knowledge and expertise. We are eagerly looking forward to hearing from them. I would like to acknowledge the management of the Institute, Vidarbha Youth Welfare Society Amravati, for their incredible support and providing facilities to make this conference possible. I appreciate the efforts and dedication by the members of the organizing committee and all the participants and delegates for their overwhelming response. Your enthusiasm and interest are highly appreciated. We have an exciting and informative program lined up for you today, which will certainly enrich your understanding of extensive research in nanotechnology. I hope you will use this opportunity to learn how nanotechnology will revolutionize the healthcare sector in future. The theme of the conference is very relevant and important. It's the area which requires critical analysis and discussion. Nanotechnology is regarded as the most promising technology of the 21st century. It has the potential to alter societal dynamics, economic conditions, and human life. So it has great promise in revolutionizing medical treatment like diagnosis, regenerative medicines, developing vaccines, and medication delivery. So before we begin with the scientific session, may I request Dr. R.O. Ganjiwale, Principal, Institute of Pharmaceutical Education and Research, Wardha, to give his introductory remarks.
Thank you, madam. Good morning, one and all. On behalf of the IPER, I heartily welcome renowned guest speakers who are nationally and internationally recognized in the field of these pharmaceutical sciences. And those all guest speakers who have generously agreed to share their expertise with us. I welcome all the participants, guest speakers, the experts from the industry, research organization, faculty members from the various pharmacy institutions to this APTI sponsored online national conference organized by the Department of IQAC and Pharmaceutics jointly. So today's national conference, as already I told you, it is organized by this IQAC of the IPER. At the outset, I just want to give a very little information about this IPER, because though this institution, it's 36 years old, but most of the participants who are joined recently here, they may be new to this institute. So I just want to acquaint them regarding this college. This is an Institute of Pharmaceutical Education and Research Borgomege Varda, formerly called as a hyper. So this hyper, it was established in 1991 and it comes under auspices of the Vidarbha Youth Welfare Society, Amravati, which is headed by Dr. Yanar Dharmin, the Hande sir, as a chairman, Advocate Uday Deshmukh sir, vice president, Dr. Hemant Deshmukh sir, treasurer, Sri Yuvraj Singh Chaudhary sir, secretary, Sri Nitinji Huse sir, executive member, Sri Shankaraji Kade sir, executive member, Dr. Vaishali Dhanda, executive member, Dr. Punam Tai Chaudhary, and Professor Ragini Tai Deshmukh, executive member. So this IPER is running B.Pharm course. It was started in the 1991 and M.Pharm in the 3 branches. Pharmaceutics started in 2001. Ology, it was started in 2007. And the pharmaceutical quality assurance started in the 1990. So most of salient features of this IPER, we are 2 times completed the NBA by the AICT. It is accredited by NBA. Then we have completed the 2 cycle of the NAC. First cycle, we got A grade. And now in the second cycle, we got A+ grade in the NAC accreditation. Institute is recognized under the 12B2F Act of the UGC, and it is permanently affiliated to that of the Nagpur University. Near about, the institute has signed a MOU with the 23 different pharmaceutical industries. Till today, we have received the funds from the AICT as well as from the DST to the various research projects. Now this institute is also running the PhD course. It is recognized as a higher learning center by the Nagpur University. Now we have a well-established, well-designed, well-maintained animal house that is recognized by the CPCSEA. And recently we got the registration for the breeding as well as for the breeding of the animal for the research purpose. We are having the well-maintained pilot plant also. We are providing the consultancy to the pharma industries of the nearby region and also providing the research consultancy to the pharmacy institutions of our region, particularly in the respect of animal studies, toxicity studies. We have the tie-up with the various Ayurvedic organization formulation industries. So they used to send their samples for the toxicity and the animal studies. So far as the topic of today's national conference is concerned, that topic is on the nanotechnology in the healthcare. And for that, we have invited renowned speakers, among them for the today's conference, keynote speaker, respected Dr. Jeenat Iqbal ma'am from Jamia Hamdard, New Delhi. And for the plenary lecture, we have invited Dr. Ashok Kumar Janki Raman, UCSI University, Malaysia. For the plenary lecture, we have invited Dr. Sanyog Jain, Naipur, Mohali, and again, Dr. Vandana Patel, Krishna School of Pharmacy Research, Vadodara. So far as the topic of this conference it is concerned, so this nanotechnology, as you know, this nanotechnology has a very wide application as a nanomedicine in the field of the medical science. Particularly, this nanotechnology is to be useful for the manufacturing of the various types of the novel diagnostic instruments, even the medical products, even the pharmaceutical products, even the various types of the biomedical implants. It can also be manufactured, and it's a part of the tissue engineering. So far as this nanotechnology is concerned, you know, this nanotechnology can be intended to target explicit cells or tissue, I can say, like cancerous cells or the malignant cell. And it can target a very specific tissue. It can target a very specific cell. And that is why this particular nanotechnology, by using the nanomedicine, it can provide us a very, very perfect treatment. I mean, a very more precise and a specific treatment can be given to the patient. So far as the role of this nanotechnology in the field of the herbal is concerned, here nanotechnology has played a very vital role in the development of the formulations of the herbal medicine, because this nano carrier, it can enhances the efficacy of the phytomedicine by boosting their, circulation, by boosting their viability, and by giving them a stable product, we can say. So particularly this nano medicine, it is used recently in the treatment of the various chronic disorders like diabetes, cancer, and even the cardiovascular diseases also can be treated by using this nano medicine. And it is more useful particularly for the treatment of the neurodegenerative disorders. So I don't want to take your much more time because the experts and they are just waiting for their lectures also. So at the last, I am very much thankful to the Maharashtra State Branch APTI, particularly Dr. Siriji Jain, for granting us the permission to this conduct a joint program in collaboration with the APTI. I am also thankful to my management, particularly for providing the financial support, even for the granting the permission to hold this type of the national event. I am thankful to all members of the task force committee. I am also thankful to all participants, students, faculty members of the various pharmacy institutions. Especially, I would like to extend my thanks to the principals of all pharmacy colleges for motivating their students and encouraging them to participate in the today's national program. Thank you. Thank you very much.
Thank you, sir. Dear delegates, it's now time for the keynote address, a moment that promises to set the tone of the conference. And it's fortune for us that as a keynote speaker, we have Dr. Zeenat Iqbal. She is a visionary. She is renowned for her groundbreaking research and profound insights. So I take this privilege to introduce briefly Dr. Zeenat Iqbal to the dear delegates. Professor Dr. Zeenat Iqbal took a first-class B.Pharm and then M.Pharm with twin gold medals from School of Pharmaceutical Education and Research, Jamia Hamdard. A diligent and dedicated academician and an ardent researcher, she has been continuously striving to achieve teaching and learning standards. Her teaching career spans over more than 2 decades, where she has handled undergraduate, postgraduate teaching with substantial contribution towards research as well. She has to her credit more than 218 publications in international and national journals of repute, about 10 Indian patents which are either granted or published, 10 books and numerous book chapters. She has figured in top 2% scientist list of the world for the years 2022 and 2023 as published by the Stanford University, which is acclaimed internationally. She has successfully handled projects worth a few crores as co-principal investigators for various government funding agencies like AICT, DBT, DST, UGC, and others. Most recently, she has handled 2 consultancy projects in herbal industry and got 2 projects sanctioned from CCRUM DST SERB of more than 70 lakhs worth. In her onward professional journey, she has produced more than 30 M.Pharm theses and 10 doctoral theses. While staying at Jamia Hamdard, she earned her PhD in pharmaceutics, where she worked for development of drug delivery systems, which would help treat the periodontal infections as a common dental affliction, warranting dedicated therapy, and contributed towards providing a commercial, viable, low-cost, affordable therapeutic. Since her early career, she has steadfastly worked on women-centric diseases and afflictions, which include breast cancer, polycystic ovarian syndrome, and postmenopausal syndrome. Her most recent research involves around preparing a formulation for the cessation of postmenopausal syndrome, which depreciates the quality of life of women and reduces their productivity tremendously. She is a dedicated teacher and firm believer of mentorship, and through her responsibilities as former Deputy Dean Students Welfare, Assistant Provost, and currently as Foreign Student Advisor, she continuously worked for students' welfare, mental health, and emotional quotient. Emotional quotient are areas of specific interest where she has aligned herself with a Lucknow-based NGO, Nurture Life. Together, Jamia Hamdard and Nurture Life has brought in webinars, talks, and interaction sessions, which has greatly helped the students to strive in times of stress and mental pressure. She has assumed positions of high responsibilities, which include being the founder general secretary of TAAJH, the Alumni Association of Jamia Hamdard, founder coordinator of SPIC MACAY Jamia Hamdard chapter, and project screening committee of Ministry of Ayush. She has been enterprising in her actions and has hosted numerous new university events, including the prestigious Distinguished Lecture Series, which saw the presence of stalwarts from different professional domains who, through their deliberations, impacted the lives of students. Through her diligently curated PharmaCon lecture series, she inculcates soft skills in students to help them prepare for their career. She has been recognized for her professional contribution in pharma domain and has been conferred upon Pharma Ratna Award 2017 by an NGO Rabdi Meher. She also received the late Sri Murugappa Sirse Memorial Award for Best Oral Presentation bestowed by APTI on a teaching body in 2018. Besides this, she was also recognized as Best Scientist in the year 2012 by SPUR. She continuously strives towards making teaching learning impactful and is committed to investing hard work, sustained efforts, and carries a far-sighted vision to carry out human welfare by all means. So, dear delegates, please join me welcome Dr. Zeenat Iqbal on this auspicious occasion. Dr. Zeenat Iqbal to speak on transforming women reproductive health, nanoformulations, and intravaginal delivery systems in addressing vaginal afflictions and overcoming biofilm challenges. Now, before we proceed with the lecture, I would like to give some rules about this session. Please keep your mic mute. Please be attentive. A feedback link will be posted in the chat box at the end of the session, which contains specific questions to the session, and the link will be active for only 30 minutes. So all the participants are required to fill the feedback form compulsorily, and your attendance is compulsory for being eligible for certificate. And I would also like to mention that do not interrupt the talk by asking questions in the midway. If you have any questions or comments for the speaker, please wait for the question and answer session. So may I request Dr. Zeenat Iqbal to start with his talk, with her talk.
Am I audible?
Yes, ma'am, you are audible.
Okay, fine. So let me just check out with my screen presentation if my slides are visible, and then I'll continue.
Yeah.
I trust my slides are visible.
Yes, ma'am. Slides are visible.
Okay.
Just make it full screen view, please, ma'am.
Okay. Let's try again. Is it now full screen? No worries. I'll just try again. I'll try again. Can somebody guide me how to go about it? Because I trust Zoom. I'm not able to see that icon of full screen here.
Hello, ma'am.
Yes, please.
You can run the slideshow at the top.
I think now it is working.
Yeah.
I trust,
yeah.
yes.
That's fine.
Okay,
That's
fine.
fine, ma'am.
Okay.
Thank you.
Thank you so much for the assistance. Bismillahir Rahmanir Rahim. I bring the greetings in. Shu Prabhat and good morning and Assalamu Alaikum and a lot of greetings from Jamia Hamdard. I am extremely honored to be present in this webinar, which is a national APTI collaborated conference, as I have been just told. I am too overwhelmed to see Dr. Shagufta Khan, who happens to be my classmate in MPharm and who is an alumni of Jamia Hamdard. I am absolutely speechless to see you, and I'm really extremely happy, and I am so happy that I was like overwhelmed when you were speaking about me. Thank you so much for this very generous introduction.
Thank you so much, Dr. Zeenat. Thank you so much.
I have to profusely thank Dr. Rajendra sir. The type of things which you are doing at IPER, I'm amazed. And this has been my first chance that I got in connection with this very great institute. And I'm sure that the type of work which you people are doing is going to make it the topmost institute in that part of the country, of course, globally as well. Thank you so much for inviting. I am extremely thankful to APTI and to all the delegates. I can see Dr. Shagufta, a huge response is there. And I will try my best to do justification to this very honorable position of speaking to you on a very interesting topic. When the initiation of this conference was held and Dr. Shagufta started and then Dr. Rajendra sir took over, they already gave you a background on nanotechnology. I am sure that the type of training which you people are getting, you are aware that how important nanotechnology has become, and it has not left any part untouched. Be it making a drug delivery system, be it making a diagnostic system, be it primarily giving you an insight into the disease association, and many more things. Nanotechnology has revolutionized what we call as your pharmaceutical system or pharmaceutical industry. I am very passionate about women health. I'm sure that as we proceed in the presentation, you would come to know that why this passion and from where this passion has come. There has always been a situation where the health of the women has been ignored. It has been ignored nationally, it has been ignored globally. But when we do statistics and when we do a homework and a background, we come to know that if we are in a position to respond to this very important health sector, we are really going to make the world a better place to live. So my topic is in alignment with both nanotechnology and the area of interest to me, that is the women health. Dr. Shagufta has already read out my topic. I'll very quickly repeat the title and make you understand. I trust that we are having both UG. Dr. Shagufta will be having UG, PG and other students?
Yes, ma'am. UG, PG and research scholars also come.
Okay, I'll try to manipulate and maneuver my presentation accordingly so that it is of interest to all of you. I would not mind if you ask questions in between as well. I will be very happy that if you keep typing your queries in the message box and maybe we can take them one by one. So the topic goes as transforming women reproductive health, nanoformulations and intravaginal drug delivery systems in addressing vaginal afflictions and overcoming biofilm challenges. The topic is very longish, but it can be divided into three basic aspects. The first thing is that we are going to harness the potential of nanotechnology to deliver a healthcare to the women, and there particularly the women reproductive health. We are going to use the tools of nanoformulations to treat certain women specific diseases, which can be called as your vaginal afflictions. And we are going to talk about a very interesting challenge, which is stopping this mechanism of drugs and resulting in resistance in the treatment, and that is the biofilm construction by the microorganisms. I am sure that this title is a little clearer to you. As we proceed further, we'll talk in detail about it. Coming to the contents, we'll be dealing with, I have just told you that we'll be talking in detail about the women health. We'll introduce you to the various vaginal afflictions and then talk about the specific drug delivery domain, that is intravaginal drug delivery systems, and talk about this biofilm and how we can, as pharmaceutical scientists, revolutionize this whole concept of health by using something as physics-based as nanotechnology. That would be our interest today. The problem comes from a huge amount of problems associated with the health of women, and therefore this icon will keep on repeating intermittently that we have to always remember that women's health matters. We cannot ignore that. There's a huge amount of interest globally, and one of the major reasons that we have risen up or we have woken up to this problem is that this problem is global. It is not leaving any country untouched. It is not leaving any social strata untouched. And one of the biggest concern is that we have limited drugs. We have many types of diseases to treat. What can we do? That is the basic question which we are going to answer today. The origin of the problem lies in the presence of the women health. You can see the next few pointers are going to give you an understanding that how variety of diseases are there which are afflicting women of different ages, particularly of the reproductive ages. We consider it very normal that there are menstruation issues, we never address them. But this is one of the basic gynecological disorders which is creating a havoc in the health of women, particularly of the younger age. That is one area which needs attention. We have a lot of issues in women because of the urinary incontinence and pelvic floor ailments. The area of interest in today's deliberation would be about the vaginal infections, which are caused by candidiasis, bacterial vaginosis, other uterine issues, and vulvodynia. There will be pregnancy disorders which need attention. There are infertility disorders which need actual treatment. We have a lot of disorders which are specific to women. They need attention. We have a list of non-communicable diseases like breast cancer and diseases which are particularly impacting the women. They need attention. And there are a lot of social disorders, including mental health, which is having a huge prevalence amongst the women. So in a nutshell, this slide is trying to make you aware that there are so many issues which are there with women health and which needs attention. And as young pharmaceutical researchers, as young pharmaceutical academicians, as young pharmaceutical students, pharmacists in making, we need to be aware of all these issues so that we can contribute scientifically to this very ignored sector of health. We move further and we will talk about today's topic, particularly that is in and around vaginal afflictions. Vaginal afflictions, as I have just mentioned, is a staggering burden of the global health. We have a huge amount of microorganisms, which is the background of this presentation is all the microorganisms which are present in the vagina and which is creating a lot of diseases. We have a new issue which is coming up, that is the construction of the biofilm on the surface of the vagina, how we can overcome. We will be talking about a very common yeast like Candida albicans, which is becoming a big havoc for the problem of vaginitis and other issues. We will talk about the various conventional and maybe later on we'll talk about the nanoformulations. I trust I'm audible. I trust the streaming is absolutely fine. I may continue.
Yes, ma'am.
Thank you. Thank you so much. Thank you so much. So this slide is very concerning. It helps me understand that how the amount of disease symptoms are present there. You may see that there are a huge plethora of diseases like sexually transmitted disease, endogenous infections like vaginosis, and various iatrogenic infections which are specific to women. And the biggest problem which I feel as a researcher is that there is a huge amount of ignorance. There will be girls and women who would not know that they are suffering from these infections. They ignore it, and that unnecessarily increases their problem and makes it a difficult to treat disease. And we decide, and when we think that there is a problem which is coming up, that comes really has come to a level that the problem has worsened badly. You can see this graphic that only 25% of the women are aware that they're suffering from such disease. So one of the interest area which I work on is that I continuously keep on doing surveys amongst the students in the community, that what do they know about the women-centric diseases, and if at all they are suffering from different types of problems. We conduct workshops so that they are well aware of their bodies. They are able to understand the concept of menstrual hygiene and the problems associated if we ignore it. You would be startled to know that 56% of the survey which were done, they were not able to relate to the symptoms, and they were ignorant about the problem which they are facing. That's a huge percentage, and that is the reason that this is one area which needs more research and more awareness. We move further. We would be talking particularly today about the candidal vulvovaginitis, which is one of the commensal culprit. Normally, when we talk of the uterine organ or the anatomy of the uterus, you primarily will be seeing it in the next few slides, that how complex the structure is. One of the problems which we are facing today, and the reason why this problem of candidiasis has become such horrendous, is because of the presence of something which we call as biofilm. To simplistically put for the students, for their basic understanding, whenever we are having an infection, there has to be a surface wherein the microorganisms will settle down, and they will just make themselves comfortable on that very common surface. Vaginal internal area is a very, very fruitful substance or substrate or a surface for these microorganisms. They are present commensally there, they are usually present there, but when the presence becomes huge or they outnumber the required amount of presence, they start causing an imbalance. And that results in what we call as the onset of the candidiasis. Later on, what happens? That this particular microorganisms, which is a yeast-like presence, you can see the whitish presence here, this settles down hugely, and it results in construction of something which we call as a microbial consortium, and which we refer to as a biofilm. Let us first try to understand that what exactly biofilm is. When we talk of a biofilm, it usually is, I'll very quickly give you a disclaimer here. Biofilm is not only concentrated or limited to the Candida albicans. Most microorganisms, including bacteria, are capable of constructing or making a biofilm. In today's presentation, we are concerned about the Candida albicans. Therefore, we are talking about the biofilm which is being manufactured by the Candida albicans on the inner wall of the vagina and the other body surfaces. Let us see how that construction of biofilm is initiated. You may totally understand that it was for the first time that Robert Koch associated a causative organism with a particular disease. It was he who made us understand that yes, we can isolate a microorganism from a human milieu or a host milieu. We can replicate that in an in vitro condition, and we can re-inoculate that microorganism and create the similar disease in another healthy host. If this information was not with us, we would never have been able to associate a microorganism with a particular disease. Keeping this in mind, let us now try to understand that how this biofilm construction happens and how this routine presence of Candida albicans becomes a horrendous experience and requires interventions of medicines. We just understand that this is the structure which a Candida albicans usually show in a mounted strain. What usually happens is that in the first phase, when we are having the addition, so let us see that this black base is something of a biological surface. This can be a surface which is biological and non-biological. In this case, when I talk about the insertion of Candida in the vaginal cavity, so I may say that this black thing which you are seeing on your screens is equivalent to the vaginal cavity, wherein these microorganisms or Candida has inserted or has ushered itself. It is already present there naturally. But because of certain conditions, which can be the pH of the vaginal cavity or any other environmental factors, they have outnumbered and they have become opportunistic microorganism there. There is a terminology, planktonic cells. Planktonic cells basically are the free floating microbial cells which form a monolayer. So the first stage would be to construct a adhesion site where the microorganism or this Candida albicans will settle down and create a monolayer. After some time, what will happen? They start secreting what we call as your extracellular matrix, and which can consist of many types of complex materials, which can be your polysaccharides, lipoproteins, and many other things. They keep on increasing and they create a mantle like or a covering like structure over them. They become present there and they keep on living inside. I usually explain it to my students that if you have got 4-5 friends who are sitting very close, head on hand collision, and on top of that somebody puts a blanket or a normal bed sheet. So the normal bed sheet or the blanket becomes your extracellular material, and you are inside in that under that blanket, and you are talking to each other. When you are talking to each other, you are giggling, you are doing everything which you can do, whatever you want to do under that cover. Similarly, the bacteria now get covered by this mantle, which is a very rigid type of structure, and primarily it is having all the material and all the bacteria protected from the outside environment. Inside that thing, they keep on huddling, they keep on passing the quorum sensing, and they keep on reproducing. After some time, they mature, and there is an expansion of this extracellular material, and this extracellular material becomes very tough to, this is an important point, that by construction of this extracellular material, which is my biofilm, I am not allowing my drug to enter to and attack the microorganisms. This rigidity which is present there in the blue color, which you can show, becomes a hurdle and results in the presence of what we call as resistance of the drug towards these microorganisms. And what we do next is, the outcome is that you are not able to kill the microorganism despite giving the drug. So here comes the problem, that the drug which was active on the planktonic or free microorganisms is not active on the biofilm consortium or the bacteria which is, or the yeast which is being under the influence of this extracellular material. So we should do something to break this up. We should do something to penetrate our drug inside it. Here our nanotechnology will come. I'll explain in the future slides that how we are able to do it. In the next phase, after this maturation, it is a very simple understanding that anything after the maturation will have to burst out, or it will try to move into some safe place. So the same situation happens with this biofilm also. Some of it will remain adhered to here, and some of the bacteria will die. The red color bacteria, the microorganism have died. And then primarily the fresh green colored Candida albicans will go and settle down on other parts of the vagina and the other parts of the urinary tract in sort of mucosal membrane, and it will start causing another bout of infection. So you can see that this becomes a recurrent and a continuous problem. So let us now question ourselves that as pharmaceutical scientists, can we offer some solution to it? Is there a possibility that we can primarily do something to this biofilm and create a situation where all the Candida is now open and naked, and they can be attacked by the this antibiotic or antibacterial or antifungal drug? Let us try to see how it works now. Before we go ahead, this is a very common understanding, my dear kids. So when we talk about any new drug delivery system, be it a targeted drug delivery, be it a nano-based drug delivery, be it a macro-based, micro-based, we first should understand that what are the available treatment modalities and how they have failed. Then only we will move to understand that how the new things can revolutionize. This is just a list of the various drugs and various types of varieties of Candida which are being approved by the FDA for the treatment. You can see that this prevalence of the disease is so much that a lot of drugs and combinations have been approved by the US FDA for the treatment. A lot of them are available on the OTC, but most of them are failing because of the reasons which we will try to understand. Again, the list is long. Some of them will be for the insertion into the vagina. Some of them will be taken by the mouth. Some of them will be a combination of both the oral drug delivery and the topical drug delivery so that a combination effect happens. You can see a lot of azoles. You can see a lot of antifungal drugs. And most of these antifungal drugs will be associated with a lot of side effects. So what would happen? The woman would go to the doctor. He would provide or she would provide some prescription. She will have to consume by mouth. She will have to penetrate it through the vagina. And after sometimes she gets so, I would say, non-compliant because of the limitations that she stops the medicine. When she stops the medicine, the outcome will be that the disease will come back with a lot of vengeance and she will primarily not be able to be cured. So this vicious circle keeps on happening. So we will be able to understand in the next few slides that how nanotechnology can help this woman to get a better therapeutic outcome. So whatever I have spoken, let me just put it in a small nutshell. That when we talk of the current treatment therapy, it will be having a lot of medicines are available. Not that they are not available, but they have got a lot of issues and disadvantages. So you will have a lesser residence time. If, for example, I think it is very understandable. All of us are biology students. We understand the anatomy very well. Anatomically speaking, when we talk of the vaginal cavity, it is gravitationally designed in a manner that it would allow the drugs to leak out. And that will result in lesser residence time. And you will have to have a frequent dosing, which becomes absolutely impractical if a woman has to implicate the drugs thrice a day or twice a day. That becomes very, very difficult. Again, there are certain anatomical limitations by virtue of presence of the mucosal lining and the other limitations for the drug permeation. Similarly, it will have a very aesthetic issue as well. It is very greasy and sticky and might be, it will soil the clothes, which is not a good feeling for anybody. And there are certain treatments which primarily are not able to treat the disease because of the presence of the biofilm. The drug is inserted, it is present in high concentration, but the biofilm, which I have just explained, is not allowing the penetration. So there will be a lot of issues which will be there with the normal treatment modalities. There can be a polymicrobial thing. I'll give you a very quick example of this. When the candidiasis happens, the normal pH of a vaginal cavity is around 4.5. When any fungal infection happens, by default of the physiology which is working there, there is an increase in the pH. Now the pH of the vagina and this normal pH of the 4.5 is self-cleansing. It is naturally made in a manner that it cleanses the system very well. But because of the infection, because of the whitish thing which I showed you, there will be an increase in the pH as well. When this pH increases, listen carefully, there will be other bacteria which are present there, which might result in their better growth. There will be certain alkylophiles, there will be bacteria or other microbial which will grow very easily on that pH. So what is the outcome, my dear students? You will have a combination of causative organisms, which is causing a complex type of vaginal infection. Candida was already present. Because of the increased pH, some other microorganisms start growing. So this from one single microbial infection, it has now become a polymicrobial infection, which makes it very, very difficult to treat. So the point why I'm making it so detailed understanding, so that as a youthful audience, you are able to understand that half of the world's population, which constitutes of women, are having problems which are not considered big problems, but they are a big burden on the global disease because of the productivity reduction which happens because of the prevalence of this disease. I would want to know that my speed is okay and I'm not pretty fast. It is working for all of you.
It's absolutely fine, ma'am.
Absolutely.
Yes,
Thank you
ma'am.
so much for the indication. So I was just mentioning a bit back that one of the reasons that why the cessation or stopping of the treatment happens or non-compliance happens. It is a chronic disease. You have to take drugs which are very sort of having a huge number of side effects. And after some time, you feel that the symptoms have stopped and you stop taking the medicine. And after a particular hiatus or a period of time, it comes back with a huge vengeance and the problem becomes much, I would say, horrendous. So, and reasons why I, as a woman, stop taking this antifungal drug is there are a lot of side effects which can be like nausea, vomiting, abdominal pain, GI upset. You can see the list of drugs here. I would not read them out, but you will be able to know it very well by virtue of being pharmacy students, that most of the azole drugs are associated with a lot of disease based side effects. And primarily with the symptoms or the side effects are so bad that the person does not have that courage to continue the medication. So that becomes a big issue, and that results in the cessation or non-compliance of the patients. This table in between, I'm sorry, the column in between is again a big alert for us as pharmaceutical scientists, that why the patient should not be given a lot of antifungal drug by mouth. You can see a lot of drug interaction happens with the antifungal drugs. Most of the women and the many diseases, like a woman who is suffering from hepatic dysfunction cannot take antifungal. She might suffer from candidiasis. Woman who is obese, having diabetes, then having a heart disease, particularly in the postmenopausal women, these things unfortunately becomes very, very common. Women who is pregnant cannot take the antifungal drugs. So there is a huge, the drugs are available, but they're available with so many limitations that we have to actually look forward to something revolutionary, which can use the same drug and primarily make a beautiful system which can underline or maybe reduce the side effects and make the formulation a win-win situation. Let us try to understand how we can do it through the various types of intravaginal drug delivery systems. When we talk of the intravaginal drug delivery system, the acronym itself, IVDDS, is clear. We are going to use the vaginal vaginal orifice as one of the one of the routes of administration. Might I tell you in the next few slides that it is a very suitable route of administration because of the anatomy and because of the presence of a huge amount of blood circulation. It results in a lot of permeability. It allows the drug to move very fast. So that becomes an advantage. I will always tell you as students that the more I understand my body, the more I understand the physiology and biochemistry, the better formulation scientist I will become. The more I am adept at pharmacology, the better formulation scientist I will become. So if you are pursuing pharmaceutics or if you are interested in drug delivery system, it is your moral responsibility that you become good in pharmacology as well as anatomy, physiology, and other associated issues of a human system or a human body. The more I know my physiology, the better system I am going to create as a formulation scientist. Keep that in mind. Keeping that in mind, we would talk about the various challenges and strategies which we will do as a formulation scientist. We will try to understand the reproductive tract, how difficult and complex it is anatomically, what are the various factors which we have to take care while we formulate, and the various types of systems which we can design. There are different ways and means by which this organ has been used. One of the ways which has been now taken is that this can be used as an actual route of administration for the drugs which are orally not very suitable. That means the drugs which might trouble us orally might be given intravaginally. There will be a surpassing of the first hepatic metabolism. There will be a lot of problems which can be solved if we are directly inserting the drug into the vagina. We have got a lot of systems which are being found suitable, and particularly the lipid-based systems. This is a organ which have been used for the delivery of contraception devices for very, very long, for the obvious reason which need not be detailed understood. We understand them very well. They have got a lot of advantages. It will avoid the systemic side effects I told you. They will avoid the first pass metabolism. It will result in optimum bioavailability, which cannot be obtained through an oral route. Then there is a lot of disadvantages also, which can be sort of an impact on the cohabitation. It could result in, there can be a low level of permeation sometimes, and there can be a limited administration because all the drugs cannot be administered through this route. So it has got certain limitations as well. This is a chart which we devised in our laboratory. While understanding the physiology, we devised, this is one of the part of my PhD students' work, where we first decided and put it on paper that how the vaginal system can work better and how the strategies can be designed for the delivery of intravaginal systems. we made a list of all the factors which are physiologically available. We could understand that the vaginal drug delivery system will definitely be impacted by the composition of the vaginal fluid, which is a natural thing which is present in that cavity. We understood that what is the pH of this. We understood what is the presence of the other cells. We knew that it is having a volume of 3 to 4 grams per hour. We know that it is directly related to the reproductive age. More is the age, lesser will be the vaginal fluid presence. It is directly present to the cervical mucus, to the presence of menstruation, to the sexual arousal, and many factors. We all got from the various anatomy and physiology books. We just put them together to make it in a strategy form. We knew that we have a very interesting thing which we called as a vaginal membrane, and this is the one which we are going to use for our drug delivery. It is receptor mediated. It has got a lot of mechanisms by which the drug will move through it. We can transport across the membrane. There will be a paracellular membrane, and the thickness of this is around 200 to 300 micrometers, which might change during menstruation, but that is a few days only in a particular month. And we can also use this organ to surpass the first uterine effect. So that is something which primarily was our strategy to design a intravaginal drug delivery system. I was time and again talking about this tract, and I was talking about the complexity. You just have a figure in front of you which tells you that how nature has designed this very complex organ. It will be a route for the birth canal. It will be the route for the cohabitation. It will result in a lot of, and now we are using it in a way that it is used as a route of administration. To understand this becomes an important responsibility when we start designing it as a formulation designer or a formulation scientist. The thing which we have just talked about, I call it as a complex anatomy. I was just figuring it out for you. I will very quickly summarize that the vaginal physiology is having a typical epithelium which is stratified, and this thickness is higher in the postmenopausal women. Why this small minutest detail is being told? The reason why this is important to us is that as a woman ages, there is a huge amount of change in this thickness. So if I'm using this route for the delivery in a woman who is young, the permeation will be different. If I'm using it for the postmenopausal syndrome, the permeation would be different. So I will have to take care of all these things when I design my system. In one case, maybe an inserted suppository is good enough, but in the other case, where the epithelium has become stronger and thicker, I might primarily have to design a nano drug delivery system which will permeate easily and result in the concentration of drug in the area where it is desired the most. That is why this detailed study of an organ becomes very, very relevant to us. It is not a new thing. We have been doing it in case of oral drug delivery also, where we know right from the mouth to the esophagus, to the first part of the stomach and the small intestine and the anus, that what are the various pHs. Like we do there, to understand that what will be the fate of my drug delivery in an oral drug delivery, I will not ignore this in case of the vaginal drug delivery either. I will understand the pH. I will understand what type of microorganisms are here. If I know it holistically, I will be a better formulation scientist. We move further, just a collation of the various other factors, the talking of the cervix mucus, the lipophilicity, the molecular weight which is suitable, and so on and so forth. So the treatment which are available, again, this slide could be a little repetitive. The only reason why I have placed this slide again is that it is not new that we are using this route for administration of drug. This has been used many, many years down the line, and it has been given successful results. Unfortunately, the results are not stable. The results are not absolutely what we want, the best results, because of certain limitations, which we just explained a bit back. Now let us start about the research which we have been doing. We have been able to understand, we started our work around 10-15 years in this area. My first PhD scholar, who is now my colleague also, luckily, we worked on an AICT approved project where we started to design a drug delivery system for the treatment of infections. We did not at that time know that what type of infection will treat. We simply made a very generic preparation. It was very well received. We could generate a lot of papers from that work. Later on, as we progressed onto it, we went in for construction of a dispersible tablet for the vaginal insertion. And the recent work which we are doing, which I will share today with you, is that we have now tried to do something very unique in a manner that we will, I'll just explain it in much more detail later on, that we are trying to make a drug delivery system, which is like what we call as the magic bullet of Paul Ehrlich, that we know our organism, we know what system we are going to make, we know how it will act, and we would also understand that what will be the outcome of it. So the next section of the presentation will deal with research work, which we have been doing, and what were the outcomes of it. We'll talk a lot of things, and I hope that you would be interested in to know, and maybe you will, some of you might get into this area and find out more about it. So this is a small journey which we usually take. Nobody will directly make any formulation which is nano. We first have to understand what are the existing modalities and what could be the reason that we have to move from this system to the final advanced system. So we move from the conventional system where we have been in the market, the vaginal gels, the vaginal creams, the vaginal ointments. Each one of them have got the limitations like frequency of dosing, patient non-compliance, poor bioavailability. They are non-specific. They might cause an irritation. They might result in soiling of the cloth, which is not very well done. So the pharmaceutical sector shifted to the new drug delivery system, which we call as a controlled system. Mostly, they created the suppositories and pessaries. They also went in for bioadhesive gels. Inside vaginal cavity, we have got this fluid which flows near the membrane, and that becomes a very good source for the mucin secretion. The cervical fluid or the vaginal fluid is very rich in that thick thing, and then primarily that results in bioadhesive. We choose such polymers which will interact with this secretion and which will adhere the system for long duration of time. So that became the basis for the bioadhesive gels. Then we also designed another systems like vaginal wings. Later on, we moved to the concept of the nanomedicines. Not to mention, this nanomedicine primarily is a revolutionary stage of drug delivery systems where we have married the nanotechnology along with the pharmaceutical sciences. So we have created a huge amount of, I would say, harmony between a physics-based design of nanotechnology to a formulation pharmaceutical design. And we created this new field of nanomedicine, which will have the use of different nanomaterials, different formulations. We can have a system which is a nanogel. We'll talk about it in the next slide. So what exactly and how exactly we can use these nanocarriers in the vaginal system? First that, and then we move on to the types of the nanosystems. We can have nano carrier system. This can be a polymeric, this can be a dendrimer, this can be a lipid base, this can be an NLC, this can be an SLM. This can be anything which we call as a nanomedicine, and we refer to it as a nano carrier. This you can see is the basal line or the internal epithelium of the internal cavity of the vagina, which is also shown in this figure. What we primarily do here is that you can see that once the nanocarrier is submerged in this vaginal fluid, it is able to release, or it is able to, I would say, what we call make an exit of that particular nanosystem. And then you can see that they can permeate through paracellularly or through other receptor based and reach the site of action and maybe do the thing which they have to do. So we went in for an era where the reformulation was designed and we could now make newer and newer systems. The question now arises that are the nanoformulations effective in treating and preventing the vaginal infections? And also, can it overcome the biofilm challenge? The question was this, and we had to answer it. The answer was a very good yes. The reasons have to be understood. The biofilm is a layer which is attaching inside of the vaginal cavity. It is a rigid layer which is not allowing the dirt to permeate beyond that vaginal cavity. And what is happening in this case, because of this rigidity, because of the very complex material, the drug is not able to penetrate and the disease was not able to cure. But when we talk of nanoformulation, we were in a position that we have got certain very good attributes, like that we will have a nano size, we will have a lipophilic drug incorporation, we can have a sustained and loco-regional release, it will not drip out, it will interact with the mucosal site, the drug will be stable, and we can have a high payload of drug when we are creating a nanoformulation. So because of these very good attributes of a nanoformulation, we could answer this question and we said, yes, we can do it Yes, we can overcome the biofilm construction. Yes, we can allow the drug to still permeate. Yes, we can treat the candidiasis. And yes, the woman can go in for a long remission of a disease which is troubling her life. All the questions were answered well. Dr. Rajender, when he was giving the opening remarks, and also Dr. Shagupta, they very well encapsulated that nano formulation or nanotechnology per se has revolutionized the whole therapy. It is available in different formats. It is available for different types of actions, and it can be designed and redesigned in manner to make a life of a patient much easy. So we, as I was just telling you, that when we understand the disease, we can primarily take care of this disease manifold. And we have a concept of a nanomedicine, wherein we are marrying the nanotechnology successfully with the medicine and creating something close to the magic bullet of Paul Ehrlich, which I may call as a personalized medicine. So I can make nanoanalytical probes to understand the disease, as sir was telling you. We can create biochips, we can create material scientists can go in for various nanomaterials, and we can make molecular medicines, and a lot of things can be done. The systems or the nano formulations which are available to us can be varied. We can have polymeric nanoparticles, liposomes, protein-based carriers, and many more particles, which we'll discuss as we proceed. These are some of the very beautiful pictures of the systems which can be easily made in our laboratory. Each system is a nano formulation, and each can be either submicronic, not necessarily under 100 or 200 nanometer. They can be a little bigger also, which we can call a submicronic thing. And each can be honed and manufactured for the reasons which are suitable for that particular disease. So we have got a huge variety of buffet from which we can pick up our menu and treat our disease accordingly. We have the commonest one which were very suitable for the vaginal delivery are your lipid or the solid lipid nanoparticles. We have the various liposomes, we can have the nano emulsions, and each one of them is like very well understood system. The lipid, as the name suggests, will be heavily dependent on the choice of the lipid, maybe liquid and solid. If we are talking about NLCs, we'll be talking more of a solid lipid. If we are talking of a liposome, then we know that which is having a biocompatibility, biodegradability, and what can be the means and ways by which we can encapsulate both a hydrophobic drug and a hydrophilic drug. The beauty of this lipid-based system is that we can incorporate both the categories of the drugs, which are water soluble, which are hydrophilic, and which are not water soluble or which are hydrophobic in nature. So it gives us a lot of what we call as your scope to incorporate and increase the payload of these drugs. When I use the word payload, I simply mean that what is the amount of drug which can be carried in these types of formulations. The more the carrying capacity of this formulation, the lesser is the amount of the dose and better is the patient compliance. So high payload is always very important for us. There are other things like polymeric nanoparticles, which can use the biodegradable polymers like PLGA. We can have dendrimers, we can have micelles. Each of these systems will have their own disadvantages and advantages, and we can select depending on our drug choices, depending upon the disease which we are targeting, and so on and so forth. We can also use something as innocuous like your colloidal gold bar, although our lab do not work on these inorganic things, but nonetheless they are available, where we can create magnetic nanoparticles and we can create mesoporous silica. Our lab usually is restricting to polymeric as well as your lipid-based drug delivery systems. We move further and we talk about something which is the one which we have been doing in our lab very easily, and this system is called as a nano emulsion. The basic difference between an emulsion and nanoemulsion is a nanoemulsion is a spontaneously constructed drug delivery system. It creates thermodynamically stable system, and that too spontaneously by virtue of using specific types of surfactants. In case of an emulsion, we might have a stability issue because of the big globules oil size and because of the hydrophilic lipophilic balance, which is not being done, and it is not a spontaneous creation. We need to do a lot of insertion of the energy through different means, maybe manually or by through homogenizers. So when we talk of nanoemulsions, they will give me a system which can be either an oil in water nanoemulsion or which can be a water in oil nanoemulsion. The size range can be as small from 50 nanometers to 500 nanometers. It will have a hydrophobic drug if I am having the oil phase inside, and you will have a water phase which is outside. You can very well say that this is the hydrophilic tail of the surfactant and head of the surfactant, and this is the tail of the surfactant, the emulsifier molecule. The key to any construction of a nanoemulsion is the best choice possible amongst the available surfactants. That is why we go in for a S mix or the surfactant mix in order to get the best HLB and the best type of stability. We have a huge variety of techniques by which we can make nanoemulsions. But we will limit ourselves because of the paucity of the time. Otherwise, this presentation is very longish, so I don't want to bore you as well. But just to have a simple understanding that nanoemulsions can be constructed two ways. We can have a high pressure homogenization, we can have a microfluidization method, and we can have an ultrasonication. The first one is a high energy and maybe a temperature generation would be there, which might not be suitable for some of the drugs which are thermolabile. Similarly, microfluidizer will use a specific equipment. It might result in some generation of attrition power. We will have to take care of that, whether our drug is able to bear the rigors of formulation or not. On the other hand, the commonest one, the simplest one, which we use in our laboratory is the ultrasonication method, which is very handleable and which is very easily usable. We can get a large, you can just simply say that an emulsion will be whitish in nature, but if you are getting a nano emulsion which is spontaneously generated, you will get a very beautiful bluish tinge, and you can understand that this nano emulsion has been spontaneously created. It is thermodynamically stable and it is not having the particulate material there. You will not see the particles by your naked eyes, of course not, but by simple presence of this translucency, beautiful blue tinge, you can appreciate that your nano emulsion must have been formed. There are different types. I just mentioned that we can have an oil in water and a water oil nanoemulsion. There can be different types of varieties. We can create a multiple emulsion. We can create a Pickering emulsion. We can create a lipid-based system later on by using the emulsion method, which can give me a solid lipid nanoparticle or a nanolipid construct, and so on and so forth. This is a slide which is emanating from our own laboratory. These are some of the publications which primarily we started our work way back in 2007, had some amount of gap in between. We had detoured to some other area, but now we have stuck to it for last so many years, and we have been continuously pouring in a lot of papers. So as I was telling you in the beginning that we started with something very simple like a polyherbal gel, moved on to acid buffering bioadhesive vaginal tablet, and now we have gone into creating mucoadhesive biomaterials and a multifunction like CPN designing, and we have created very recently NLC and SLN paper as well on the same area. We had this synthetic drug like cyclopyrox, which resulted in the formulation of SLN. We were able to create some of the other formulations, like some of the papers are from the other publication house as well, which primarily is sort of associated with the similar work. But most of the papers are from our own house and mostly from my own students. So as we move further primarily, we will be now talking about an important aspect. Just give me a bit. I think I have a very urgent call to take. Just a bit, please. I'm sorry. I'm extremely sorry for this. So when we were talking about this thing, so as I was saying at the beginning itself, and by now you must be aware that we have been moving from a little simple method of conventional system, and then we passed on to creating a nano formulation. So we now adopt something to which we call as a design thinking based drug delivery system. So we'll just try to, this is the next slide is something which is very, very close to, I think this slide is a very common slide. Each one of us must have seen it many times. You Google this out, this comes within 0.02 seconds. The intention of this slide is to just keep on increasing our morale and motivating our good selves as pharmaceutical scientists, that this is the difficult journey which we take from 0 years to 12 years when we create a single drug molecule, which is becoming a formulation, and how precious that drug delivery or how precious that molecule is to us. You can see that this is a very long and risky road. The designing and everything takes a lot of hard work, a lot of scientific deliberations, and then we create this drug. When this drug falls prey to the microorganism, just listen to this statement next, that I have created an antibiotic, and now after creation, spending 12 years, billions of dollars. I come to know in 2023 that this drug is not working anymore in the microorganisms. I will feel bad because this billion-dollar industry creates one drug after so much of clinical trials, so much of hard work. So that drug is very close to my heart. I will try to salvage that drug, resurrect that drug in one way or the other. What has come handy to me as a pharmaceutical scientist is that I can use my attributes of formulation to salvage or repurpose this drug, which is now going down the line of resistance. So I use nanotechnology or nano formulation to make this drug effective for many, many years to come. That is the motivation, and that is what we call as the concept of repurposing and design thinking. Gone are the days when we were students. I think Dr. Shagufta would be remembering that we used to enter the lab at 8 o'clock in the morning till evening. We will make tens of formulations. Many of them will not even work for half an hour, and we were very disheartened. Nowadays, there is a concept which we call as your design thinking based drug delivery designing system. We know everything and anything about that drug. We will use n number of technologies. We will try to use the chemistry, the pharmacology, the research trends, the formulations which are available, and then we will create a strategy for treating that particular disease. Knowing everything in between, we are able to make a precise blueprint for making a drug delivery system which will be successful. So we are nowadays using all these concepts. That is what I said in the beginning, that I should know my physiology, I should know my conventional drug delivery systems which are available, I should know the disadvantage and limitation of my drug, I should be able to understand the various concepts and various other things which are available to me, and then use it for making a system which is foolproof and which is a prototype which will always succeed. That is what we are doing today. The next section of the presentation is, I would say, a showcase of that journey which we have taken to create a foolproof design-based drug delivery system for treatment of candidiasis. Let us see how we did it. I am sure that this one statement will really go well with you. It would have been so good if I know my microorganism inside outside and I know how to kill it. I always know as a microbiology student or as a biology student that a microorganism will have different attributes in different types of host system. There will be a separate type of population of microorganisms which are present in a human population in a particular area. That will depend upon its nutrition, that will depend upon its economy, that will depend on many other factors, which we called as your epidemiological factor. Simply speaking, what we did in this case, this work was something to make an effective formulation against the Candida albicans, which was present in the population, which was in and around our campus. When we are talking about this thing, I think this is going to be very interesting take for all the research scholars who are present here. What we did, we wanted to create a formulation which was 100% working and which was a best formulation which should be possible. What could be better that if I know that what type of microbial presence is there in my population which comes to my hospital. So we live in Jamia Hamdard. Jamia Hamdard University is located in South Delhi, and there is an area which consists of a place called Sangam Vihar, which is very similar to Dharavi in Mumbai. So the low socioeconomic and the presence of a teaching hospital, most of the patients we draw from there. Not that the other patients don't come, but the pool of patients which come is from this particular vicinity of that particular hospital in which we are talking about. I live in the campus, so the hospital is also in the campus, and the in and around we have got a huge population which usually come to our hospital for treatment of all diseases, including gynecological problems. So what we did in this case, we have an ethical committee in our institute, we have an animal ethical committee, we have a human ethical committee. Now what we did, we have women patients who are coming to our OPD. So we took a gynecology permission from the various committees, and the gynecologist was on board with us. The women patient who are coming to her OPD, for the candidiasis. She was able to diagnose. We as pharmacists cannot diagnose. So she was able to diagnose. She was able to tell us that this XYZ subject or the woman is suffering from candidiasis. We requested her to take out the vaginal swab from that particular candidate or woman who was suffering from the candida infections. So we were able to get the high vaginal swab samples, and these swab samples were taken by using the sterile swabs, which you can see. This is like very much similar to the earbud, but a very longish one because it has to enter into the vaginal cavity, and we were able to get these samples. We submitted this sample to our teaching hospital where we had a microbiologist with us as our team member, and there was a particular technique which we call as a Vitek card technique, and we were able to isolate and identify that the sample which was collected from the women patient was actually Candida albicans. So we were able to analyze it. Then what we did was that we established the biofilm. I was telling you again and again that the bacteria will go and rest on the mucosal membrane. It will create a biofilm. This biofilm is not allowing the drug to enter. So what we did, we created the same thing in an in vitro condition in this 96 well plate. And then when we were able to create it, we were able to see that this, you can see the figure, half of it is hidden because of this panel of the photographs. But here we can see that the biofilm was constructed, and then we tested it against, this biofilm was tested against our own formulation. So this is the strategy which we followed, that they took the real samples from the women in the hospital. We submitted those samples and identified them to be Candida albicans sample, created their biofilm in vitro, made our formulation, tested our formulation, found out at what concentration it is resulting in the break of the biofilm and what is the effective minimum inhibitory concentration. When I knew this, I could create 100% successful type of drug delivery system, which would absolutely clear the Candida albicans from the vagina and do it in a very short time and not have all the problems which were associated by a conventional system. Having said this, we created a nano formulation which was funded by ICMR and which had got 3 basic approaches. We made a multi-particulate system, the first M, we made it mucoadherent, the second M, and we made it a modified release. So we were able to create a drug delivery system which was multi-particulate, mucoadherent, modified release, which was delivered through a gel, and that transvaginal gel was able to disrupt the Candida albicans biofilm and finally resulting in the clearance of this infection from the vaginal cavity. Another interesting thing which we did was that we primarily did a study which we refer to as your, again, maybe this can be of interest to the PhD scholars. Before we actually decided on what drug we will take, we went in for what we called as your in silico designing. In silico, as the word suggests, is a simple computer-aided drug delivery designing, where we use different softwares. Based on these softwares, we were able to identify the actual sites at which our chosen drug will act. In this case, we selected luliconazole, which was able to act on certain specific sites on the Candida albicans. So our drug choice was fantastic. It will only act on that particular site. Our drug delivery system was absolutely fantastic. It has got 3M approach. It will adhere to the vagina. It will penetrate through and it will modify the release. So everything we strategized was in a manner that it will become a targeted drug delivery with a magic bullet effect. That was the science behind it, and that was the ethos behind it. So this paper was published half the way that we selected this API. We created it into a solid lipid nanoparticles. We had a proof that it is working against the Candida albicans. We did the TEM like we do in for all other things. We characterized in different methodologies, and we were able to prove that this system was active against the Candida albicans. We moved further, as I was telling you, that the next, this was a paper which we published ahead of the biofilm thing. As I was just telling you, that we were absolutely very sure of one fact, that our drug delivery system should not be hampered because of the biofilm which this Candida albicans is going to construct. And because Candida albicans was able to construct it in vitro, we were doubly sure that inside the vagina also it will give us a problem. So what we did was that we selected this beautiful molecule luliconazole, and unfortunately it was not much used before it. So we took a risk. We never had a reference that will be used for intravaginal, but we took a risk that we chose this luliconazole based on our in silico studies, where we were able to get some reports from that software of Schrödinger that it is going to act on the lanosterol 14 alpha demethylase. It will cause it inhibition, and that will break the cycle of the Candida albicans, and that will result in complete destruction of the biofilm, which was saving that Candida albicans. When we got this evidence from the software, we were absolutely over the moon, and we think that that was the first success which we got, that yes, luliconazole has got a double action. Not only it is going to act as a antifungal drug by routine mechanism, but it is also acting as a anti-biofilm. And then we created a system which was more, I would say, targeted to both create both destruct the created biofilm as well as maybe making the formulation as an antifungal agent. We moved further, and as we were moving further, we were in a position to prove our point, and you can see that two beautiful publications came out of it. First, our concept was published in Medical Hypothesis, and later on we were able to publish it in ACSM Omega with a high impact factor, which talked about the in silico guided nano formulation. So this concept of in silico designing, that how we are having a receptor mediation, why we are selecting luliconazole, was also formulated in the publication. So we have already talked about it, that how the basis of our study was there, that why was this disease selected, and the formulation, the nano size and everything. So this is just a simple stepwise thing which we did. So first, when we were creating the lipid nano formulation, we went in for the screening of excipients, the one which were suitable were picked up. Similarly, we went in for the selection of the binary lipid phase. Then we went on for the selection of the suitable methodology. We will characterizing it in the form of zeta sizing and the particle sizing. What was the, you can see the visibility of this formulation. So anything and everything which was able to give us data about the characterization, we were in a position to generate our data accordingly. And then we also put in a tool of quality assurance. Nowadays, when we talk of design thinking, we think of our product before, and then we align all our formulations parameters accordingly. So this concept is called as your quality by design. So we know that what is our quality target product profile. So we will have our targets in terms of the particle size. We will have targets in terms of our sort of therapeutic expectations from this product. And we did a very detailed analysis that what will be our critical quality attributes, what size will be suitable to our formulation, what should be the entrapment efficiency, and so on and so forth. So idea, my dear students, is that we cannot, or we should not make a formulation blindly. We should first try to create a blueprint. For example, if I select a lipstick today, my first thing is that it should be looking good to me. The packaging should be fantastic. That becomes my first attribute. The second thing which will be very important for me is that it should give me the color which I desire. The third thing, for example, would be that if I put it on the lips, I should not have to fight daily. It should very smoothly go, and the color should be retained for a long duration of time. Simple thing you can extrapolate to any formulation. Why it should work, how it should work, what should be the way it should be taken care of, how the patient will look at it, whether it will be easy to apply, whether it will give me the same outcomes, whether it is nano sized, whether it will permeate well and all. If I talk about it before I start creating my formulation, this is what we call by quality by design. This is what we call as design thinking. Nothing new, nothing big. The only thing is that we do it, but here we will do it in a very systematic manner so that we are able to understand what are the risks associated, what are the problems associated. And before I get into a big issue at the end of my whole process, how can I cut short my problems and bring in the best possible design in terms of raw material, in terms of optimization, in terms of energy consumption, and so on and so forth. So all these things have now changed the whole scenario of formulation design. We do not make formulations by hit and trial. Rather, we make formulation with a lot of scientific insights into it, with a lot of softwares available to us, and then move on to the best possible design, which will be our best prototype to give us the best formulation and with the desirable and optimum therapeutic outcomes. So, and needless to say, I think all MPharm people will relate very well that we have got a lot of softwares like box Benton design, composite design, design expert softwares are available, which will help us to understand what are our independent variables and what are our dependent variables. Just for the UG people to understand, whenever I will make a formulation, I can have an X and a Y. So on the X axis, I will have any formulation independent variables which are under my control. For example, I know how much lipid to enter or how much surfactant to enter. This is under my control. And these two parameters will make some impact on my y-axis, that is my dependent variable. So my dependent variable can be the particle size, it can be polydispersity index, it can be an encapsulation efficiency. If I am able to choose my independent variable on the x-axis with a lot of sense and intelligence, then my dependent variables with the one which will be the most suitable and the most optimum. In order to put it, when we were student, we do it hit and run. Increase the concentration of lipid, fix the concentration of surfactant. Find out which lipid is important, how much lipid is to be added, what amount of surfactant to be added. Hundreds of formulations. Now you put all these things into a software, they will give you something like this. They will give you a chart and they will tell you that what are the things which you will get. So for example, in the 10th formulation which they are giving, you will have to use these parameters. Total lipid is this much, total amount of concentration is this much, and the particle size, which is my desirable particle size under 225, I am getting into this formulation. In place of hundreds of formulation, I will only construct 12 or 17 runs. And in the 17 runs, I will get my most optimized formulation. So we are cutting down the task. We are making the designer formulation in a manner which is the most optimized and the most suitable. You can see all these graphs. You can understand them very well, that each one of them, the X, Y, and Z 3D structure, they are giving us an indication that if I'm increasing the lipid concentration, what is the impact on the encapsulation? If I'm increasing the surfactant, what is the impact on my particle size? More the surfactant, more is the ultrasonication time, lesser is the particle size, and many other parameters. I cannot take each one of them. I would have loved to take, but the nutshell mein, what you have to remember is that you have to be very theoretically understanding that what are the requirements which you will need in the practical aspects. So I will design and redesign these formulations and finally get my optimum formulation, which can have the size, which is my desirable size. You can see 207 nanometers is my desirable size with a beautiful uniform peak, which gives me a PDI of as less as 0.2 and which gives me the payload and particle size, which is interestingly very suitable for my own work. You can see that we further went in for the various other tools like electron microscopy. We could get a SEM image because the particle size were very low, therefore the SEM was not very clear, but we could still see the topology that is very smooth. And you can see the TEM, incidentally, Jamia Hamdard has its own transmission electron microscope, and we were able to get the particle size, which was equivalent to the one which we got from the graphical designing. Then we went in for the rheology, that what is the amount of viscoelasticity, because we had put it into a gel form so that the insertion becomes easy. We did a texture analysis on that and found out what are the various forces which are there and whether the gel will be adhering to the vaginal site or not. So these were other characterization parameters. Then we went in for the finding of the release. We were able to understand that the release permeation, both in vitro as well as ex vivo, was good enough to maintain the drug much above the minimum inhibitory concentration of Candida albicans, which was then also corroborated with the microbial studies. Then we moved in further for an in vivo analysis of the histopathological assessment in order to rule out any irritation. One of the major deterrent for an intravaginal delivery is unfortunately the presence of irritant. So if a formulation is irritating to the vaginal cavity, the whole purpose is defeated. So it is mandatory that in the animal studies, we do a study in order to find by virtue of scoring that the vaginal irritation is 0 or minimal, and that will help us to make a formulation which is easily acceptable by a human woman. You can further see that we went in for the microbial studies of anti-candidal activity, and you can see that the complete removal of the film was there, a complete removal of the Candida was there. We also went in for the understanding, as I have told you in the beginning, that how this mechanism is going to work. So we were able to give evidence for that also, that this is the reason that why this biofilm has been eradicated. This is the reason at this section or this point of the Canada, the drug is acting, and that we were able to get from the this in silico studies. So we were able to join the dots, and we were in a position to make an evidence that yes, this drug formulation is working the manner which we had strategized. We moved further, and these are some of the snapshots of the various studies which we did in order to find out the eradication or the antibiofilm effect of the formulation. We tested the formulation, which was the optimum formulation, against the biofilms of the Candida albicans, which was isolated from the human patient, and we were in a position to very successfully exhibit that the biofilm was successfully eradicated. What does it mean in context with the therapy? That the formulation has been well designed, it will very well permeate through the biofilm and will enter into the system and kill the microorganism and make the problem resolved. So that was an evidence for our success, which we think will also replicate in a human system. Some of the other slides where we further went in for the construction, you can see that the drug was so potent that the minimum biofilm inhibitory concentration was so low as 0.488, whereas the eradication was again at a very low concentration of 0.976. So that is the first time that this luliconazole was found to be so suitable in ameliorating the disease caused by the Candida albicans. All these studies were done under the Institutional Ethics Committee of Jamia Hamdard, and the samples were procured under the supervision of a gynecology practitioner. And the conduction of all these studies were done in the microbiology lab of our hospital, that is the Hamdard Institute of Medical Research. Some of the pictures showing the disruption of the biofilm, you can see that the biofilm was this strong and it was not allowing the penetration of the drug. All the bacteria were hiding under this mantle, and after this, there was a complete inhibition and further eradication of this biofilm. This whole mass, which you can see here, was captured under the fluorescence microscope, and after the therapy, you can see it has gone all null and void, and finally, you can see that the biofilm has been successfully disrupted. So that was one big success, that we were able to get that the biofilm, which was constructed by a human isolated Candida albicans, was successfully inhibited and eradicated by the formulation which was developed in-house. This is a summary and the conclusion. I think it was a very longish presentation, but I trust I could make some sense to all of you. The first conclusion is that we have to realize that Candida albicans causing vulvovaginitis is a problem which should not be ignored. It actually troubles the woman so much, and more so when she is in a postmenopausal syndrome or a premenopausal area. So we have to be a little more receptive to these things. We have to create a lot of surveys, a lot of awareness amongst our female as well as our male students. The main causing organism which we found in our population was Candida albicans, which is in accordance with the global standards, that mostly in the world over, Candida albicans is the organism which is associated with this particular candidiasis. There is a lot of limitations which are available, so we don't have many successful tools. Therefore, the one which we created happens to be one of the suitable tools which we can think of. We could fabricate and tailor make a customized drug delivery system, which was very successfully able to inhibit and eradicate the biofilm, as I just showed it to you. The research will be hopefully pharmaceutically active, and it will be a path-breaking research endeavor. So we have been able to publish this work in a journal, which I have already shown to you. So this is the, I would say, the last submission, that we could create a nanoemulsion. We converted that into a nanogel. We are looking forward to that. These are some of the other things. The take-home message from this presentation is that we can create a lot of nanoformulations which can be promisingly delivered into the vagina and primarily result in the treatment like a magic bullet or like the targeted drug delivery to improve the health outcomes in the woman. These were some of the very important references which I would like to sort of acknowledge. And thank you so much for all your time and attention and support which I have got through this presentation. Thank you so much. I'll be very happily taking all the questions. Over to the organizers now.
The session is now open for questions.
Can I stop sharing, Shagufta? I can stop sharing the presentation. Dr. Shagufta, am I audible?
Yes, ma'am, you are audible.
Okay, fine. Thank you.
The session is now open for questions.
So, ma'am, may I ask question?
Yes,
Yes, please. Yes, please. Yes, please.
So, myself, Dr. Vaishali Kilor from Guru Nanak College of Pharmacy, Nagpur.
Welcome, ma'am.
Thank you very much for such a nice and very it has given many ideas to researchers, and it was very much understandable.
Thank you so much.
This 3M approach is wonderful, and I just have a question that these solid lipid nanoparticles which you have prepared, what kind of gelling material will it's suitable to disperse those uniformly, and because there are certain issues with these gels.
Sure.
So please.
One thing, shall I respond? If the question is done.
Yes.
Okay. So absolutely well taken that when we are talking about the SLNs, they are a little problematic. While we manufacture them, also we have to really go a lot of changes when we talk about the selection of the lipids, as I just explained to you. But fortunately, because luliconazole was having a very high payload, it is highly lipophilic. So the amount of SLNs which we had to actually incorporate into a gel was much lesser. I hope I'm able to make my point.
Yeah.
And fortunately, when we tried it in the carbopol gel and polaxamar 148 and 128 and the other varieties, we were able to disperse them very well. I would only suggest that when we are dispersing, because if we very rigorously stir it, then again the rheology and the viscoelasticity will be compromised. So we can simply put it drop by drop and maybe incorporate in a very slowish manner, and ensure later on that we can take samples from different parts and then find out whether the uniformity of mixing has happened or not. It does cause a problem, but because the amount of SLNs which are incorporated into the gel are still less, so it doesn't become that difficult to incorporate. It is just like maybe 1 or 2 trials can help you out.
Yeah.
You may also go in for some sol to gel conversion things, because if you are able to select a thermosensitive, because the temperature also is different in the vagina, so also the pH. So you can also go in for an approach of a pH sensitive and a thermosensitive gel.
Okay.
So it will be liquid, the SLN will also be liquid, and then when it will insert into the cavity, it will convert into the gel, it will adhere for a longish period of time, and you will be able to get your modified release for over a period of, let us say, 6 hours or 8 hours or 12 hours.
Okay. That may be a good solution.
That can be done.
Yeah. Thank you very much.
Yeah, you're welcome. Thank you so much.
Dr. Zeenat, there are some questions in
Okay,
the
I'll
chat
read.
box.
Shall I read and then answer?
Yeah.
Okay,
You
fine.
can.
Thank you so much. Thank you so much for the compliment. Please give insights.
May I ask you a question,
please,
ma'am?
Dr. Natali. Please.
It was a really nice presentation, and particularly on a very important topic, I'd say, because as you have said, women's health matters. That is very true, and that is really the ignored sector, and it affects the overall health of the society, I will say.
Absolutely.
My small question is that when you're using the nano emulsions, we are using the type of surfactants which are in higher concentrations, and these surfactants sometimes they irritate the mucosa.
Absolutely.
So what is the exact concentration that can be safely used?
We should try to use, again, this will be, I would say, a little bit of tricky task, because nowadays we are having the softwares which are available. The ternary phase diagram, which Dr. Shagufta, if you remember, we used to really make it everything manually. But nowadays we have got softwares. We have a list that what amount of S-mix has to be taken. The intention is, what I have personally felt, if it is kept as, and HLB will play an important role.
Yeah.
If we are able to select the surfactants ahead, keeping the HLB in mind, which is non-irritating to us, it will be a big, I would say, insight. A percentage which is up to 30% is sometimes okay, but then that can result in micellar formation. So that is a ball game, that how much to use and how much not to use. But the what we did at the end, if you see the last couple of slides, we went in for the intravaginal assessment of the irritation in a rat model. So we were doubly sure that that gel which we are using, we had tried everything, HLB was everything fantastic. And rather, to be honestly speaking, we even tried on our own skin that whether it was irritating or not. But doing a small study in 5 animals helped us greatly to generate data that it was absolutely non-irritant. And luckily, the new semi-synthetic surfactants which are available, and this company, BASF, they're supplying a lot of semi-synthetic and derivatives of different surfactants, which are very mild and they are not irritating. So we can go ahead with those types of surfactants.
Okay, thank you so much. And the second question is, when we are doing the in vivo studies, in the histopathology, particularly only the irritation is to be seen, or are there any other criteria which are to be seen?
What we did was that because the animal size is so small, but we have trained ourselves in that. So we insert the formulation into the vagina of the selected animal. And then after the insertion, over a period of day, for example, we insert it for 15 days. We also go in for scoring visually. We will see the redness, we will see the presence of puckering or any other parameters which we have decided. Then we give a scoring to it. If the score is above this, then it is irritant. If it is below this, then it is non-irritant or mild. That is one way. After the last day of the study, we sacrifice the animal and we remove the vaginal section, and then we send it for histopathology. Then a trained histopathologist, in terms of the anatomy and the other tissue presentation, he also submits a report that whether it is resulting in some vasculature dysfunction, some blood vessels have what we call separated, or inflammation has caused. Then we corroborate our scoring with that histopathological studies, and then we submit the results. So that is a foolproof thing. I don't think that has another issues at all. It is 100% reliable means.
Okay. And Carbopol 974P, it works? Okay.
It works. The only thing which I would suggest is that because it might result in a little lumpiness. So the way you mix it and keeping it overnight will help us. So the way you mix it will decide whether it is going to be like non-lumpy. Because what happens usually, if we take more concentration, it becomes like what we call as, or some lumps will be like together. So that makes it very uneven. So we have to be sure that what percentage. So what we usually do is that we take a series of percentage, beginning from depending on literature again. So we just have an intermediate thing also. Let us say 0.5, 0.75, 1, 1.5, 2, 2.5. And the two extremes will help us decide that this is to be removed. And then in the between, we might go in for some slight changes. So usually 1% around it is like, okay.
I think some thermosensitive polymers may prove better because we can use the applicator and then.
Absolutely. That is my, one of the papers, if you saw, which I was showing, was that on thermosensitive, and we got it published in record 15 days because the concept was very well taken. So because the insertion using that longish applicator, and nobody is going to apply it for you. So you have to train yourself. So the easy on a woman, the better it is. So a thermosensitive or a pH sensitive, which is liquid in the normal temperature and then changes to the gel, the sol to gel system, that would be the most appropriate.
Okay. Yes, sure, definitely.
Thank you so much.
Thank you so much.
Okay. So we have the secretions from uterus vagina hinder the application of medicament. As I told you in the beginning that we had tried to understand and accumulate and put together all these factors. Of course, the menstruation will hinder. The cohabitation might hinder temporarily, but over the period or over the month period, the secretions are more or less routine. They are not too much changing. So that is absolutely okay. And thank you so much for all the accolades in the message box. They're really motivating. I really have this topic very passionately attached to my own self, being a woman. And all the women scientists and teachers who are here, I have struggled a lot to get some funding on these areas. And very rarely it happens that somebody is like thinking of this problem as a disease. And one of the funding agencies, when one of my students was facing an interview, she was told that this doesn't kill anybody. But I really am passionate about it because this is one area which really needs attention. And we should have more women scientists working in this area. Of course, not limited to women, we should all work in this area because a lot of things needs to be changed.
Dr. Zeenat, there is one question from, I think, Nishan Bobre in the
Okay.
chat box.
Dr. Gupta, can you just read that out to me? I'm not able to find it. Aap pad denge?
He asked that what kind of container system required to attain the successful
Okay. I missed that question.
for
It was there.
nano and micromedicine or nanomedicine.
Okay. So again, because as far as this the vaginal system is concerned, we will need to have an applicator. So normally, I showed you in that conventional drug delivery system, we can simply have that normal container which we have for gel, which is normally associated with a longish type of applicator. And because if it is a sol to gel system, not an issue at all. Even if it is a gel, we have got specific applicator. So I don't think there is anything which is very specific which is required. The normal intravaginal applicator can be also employed for delivery of the nanoemulsion gel or any of the systems which I discussed. Stability and all we always try in ahead of marketing or ahead of putting it in the normal use. So stability has to be done as per the ICH guidelines. There are certain specific guidelines on ICMR website also about nanopharmaceuticals. We should also visit them. So after we are able to assess the stability based on all these understanding, this normal container can be used as we do it for the other applications. I trust I have been able to gratify the query. If there is any other
Yes,
question.
excellent, Dr. Zeenat. Indeed, I am speechless.
My
The
God,
way you have explained the physiology of vagina, the barrier in drug delivery, the disadvantages of current treatment lines, and the restriction by the biofilm, and how the nano carriers, nano formulations can overcome the biofilm to have the sustainable effect on a very hard to treat Candida albicans infection. So thank you very much, Dr. Zeenat, for your enlightening speech, for inspiring and captivating the audience.
oh my God,
You
you
have
are too kind.
indeed-
You have always been so kind to me. I remember right from
Yeah.
our student days, you have always been kind to me.
Actually, Zeenat, you have indeed ignited a passion for exploring new frontiers in vaginal drug delivery system.
Thank you so much. If I'm
It
able
was
to
indeed-
even
It
trigger
was
one person,
indeed
I'll be obliged.
it was indeed a pleasure and honor. And we all are indeed very grateful to you, Dr. Zeenat, for
Thank you so
sparing
much.
your time and for being with us today.
Thank you so much.
Thank you. very
Rather,
much.
I must be thanking you immensely, and I trust we are in time. And thank you so much, Dr. Rajendra, Dr. Mitali, and other faculty members, Dr. Abhiram Deshmukh ji. Thank you so much, and I'm really honored to be amongst the students and the faculty members. This is my first sort of talk amongst this group, and thanks so much, Shagufta, for connecting after 2 decades. It was a pleasure talking to you like always.
Yes,
And I
yes.
never felt that we are talking after such a long time. Thanks, Dr. Rajendra, for being kind and allowing me to be a part of these wonderful deliberations.
Welcome,
Thanks a
ma'am.
lot.
Welcome. You
Thanks
are
a
always
lot.
welcome.
And
Thank you so
I am
much.
also thankful to all the participants for their active participation and for hearing the speech, excellent speech delivered by Dr. Zeenat. And I think the link will be posted in the chat box. So all of you have to solve some questions provided by Dr. Zeenat on her topic. And we will resume at 1:50 p.m. There is another wonderful lecture in line at 1:50.
And you have really attracted very good speakers from very good institutes. I must congratulate you people for doing this wonderful job. And thank you all
very
the
much,
students.
Zeenat, and I hope the same kind of association and collaboration from
Sure,
you in future.
sure, in the future. And thanks all the students from my side as well. They are wonderful audience, and the type of discipline and the type of deliberations, I am amazed. Nobody left the room, everybody was there, I'm sure, and this is something difficult to hold 230, 250 students together, and that is the charisma of your organization. Thank you so much. I'll take your leave. Thank you.
very
I'll
much.
take your leave now. Thanks a lot. Thanks a lot.
Thanks, ma'am.
Okay. Bye.
Bye.